Hello everyone, am I audible and visible to you? Am I audible and visible to you? Okay, so myself Dr. Shital Ghataliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I am educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. With iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, you will find various resources like well-structured live batches, recorded classes, competitive live tests and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now Unacademy came up with some special class feature. Now what is this? Here the classes will be highly interactive. There will be also a poll for the learner. You will raise the hand. You can raise the hand and you can interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes will be available. You can attend the class from any time, anywhere. As I told you, there is a highly effective updated question bank is there. More than 25,000 high yield clinical questions are there which are based on latest exam pattern and it includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy. As I told you, there is a feature raise a hand. So now you will be engaged with the quizzes, viva, doubt solving sessions, and many more. Unacademy Medical PG tests is there. Free test reviews are there. Educator curated test series, FMG grand test series, study with me YouTube test series, and many more. Plus best test reviews, you will find NEET PG 2022 subject wise test series, NEET PG 2022 grand test series, and many more. So there are two batches. Focus FMG 2022 comprehensive batch, duration is 6 months, already started from 15th of December. Target NEET PG 2022 taste and discussion batch, or duration is 3 months, already started from 15th of December. So both the subscription plus as well as iconic subscription, both are available with various duration and different prices. You can use the code Shital 10% off on all Unacademy subscription. This is available from January 30 to 31. Okay, use the code Shital 10. Now come to today's topic, that is image based learning of general physiology. See, in the previous class, I covered about certain topics of general physiology like cell, mitochondria, and many more. Today, I am going to cover about transport across the membrane. So, see this image. Okay, let us have an overview first. Overview of the transport across the membrane. See. It can be active transport, it can be passive transport, or it can be vesicular transport. Passive transport, see the word itself says passive, means it is a downhill movement, right? Downhill movement. So here no energy is required. just a overview, right? And no energy is required. So example of a passive transport is osmosis and diffusion. So this is the image of facilitated diffusion. Now what is this facilitated diffusion? Understand the word carefully. Facilitated means diffusion. Usually simple diffusion, it goes according to the gradient. But in facilitated diffusion, it will not be able to go according to the gradient simply. It needs some sort of help, facility, right? That's why we can say it is called as a facilitated diffusion. So here we need carrier protein. We need carrier protein. Okay, so what will happen here? Let's take an example. This is the substance which needs to be transported. So in the carrier protein, there is a binding site. Okay, there is a binding site for the substance which needs to be transported. Once the substance bind with the binding site on the carrier protein, it will cause the conformational change. It will cause conformational change in the carrier protein, and that way it will allow the substance to move across the cell membrane. So this is called as a facilitated diffusion. In simple diffusion, simply it is moving across the cell membrane according to the gradient. It can be concentration gradient, it can be pressure gradient, it can be electrical gradient, whatever it is. Okay, but it simply goes according to the gradient. In facilitated diffusion, it will go according to the availability of the carrier protein. So we need carrier protein with which the substance will bind. Once the substance which needs to be transported will bind with it, it will cause the conformational change in the carrier protein, and then it will allow, because of the conformational change, it will allow the substance to move. Okay, so that way it will work, right? So that is a facilitated diffusion. Now this is very important image based question. Okay, on the x-axis there is a concentration of the substance. On the y-axis it shows the rate of diffusion. Now see this one, simple diffusion. This is the linear relationship. You can say as the concentration of the substance increases, it will cause increase in the rate of diffusion, right? As it is directly proportional, you can say, right? There is no point of saturation in simple diffusion. But in facilitated diffusion, initially increase in the concentration of the substance will cause increase in the rate of diffusion up to some point, right? Later on, further increase in the concentration of the substance will not cause further increase in the rate of diffusion. This is saturation point. Okay, beyond which maximum. Okay, beyond which the further increase in the concentration of the substance will not cause further increase in the rate of diffusion. Now why so? In simple diffusion, it is going according to the gradient. But in facilitated diffusion, we need carrier protein, availability of the carrier protein. Good evening. Happy to see you. Yesterday there was some issue with the audio. Today I am covering the same topic. Okay, so in simple diffusion, it goes according to the gradient, right? Concentration gradient, pressure gradient, or electrical gradient, whatever it is. But simple, it doesn't need any sort of help. Any carrier protein is not needed, right? Simply it will move, right? So in facilitated diffusion, we need carrier protein. So availability of the carrier protein matters here, right? So in facilitated diffusion, when you start increasing the concentration of the substance, for a while it will cause increase in the rate of diffusion. But up to some point, beyond that, further increase in the concentration of the substances is not going to cause increase in the rate of diffusion because carrier proteins are occupied. Now, right? So that there is a saturation point. For facilitated diffusion, there is a point, Vmax you can say, saturation point you can say, where further increase in the concentration of the substance will not cause increase in the rate of diffusion. So this is very important image, I can say, image based question. This is the saturation point. On the x-axis it shows concentration of the substance, on the y-axis it shows rate of diffusion. There is a saturation point. Now come to this one, osmosis. Osmosis is also one type of passive transport, right? Here what will happen, the two solutions, if we imagine two solutions which are separated by the semi permeable membrane, here water molecules are allowed to pass. So where the water molecule will move, from the lower concentration of the solutes towards the higher concentration of the solutes. Okay, so water will be able to move from lower concentration of the solutes to the higher concentration of the solutes. Now this is important question on osmotic pressure. What is this? Now the pressure which is needed to prevent the process of osmosis is osmotic pressure. Okay, now this is again one important image based question. See this carefully. This is cell membrane. This is sodium potassium ATPase pump. Sodium potassium ATPase pump. Okay, it is located in the cell membrane. See, there are various subunits, alpha, beta subunits are there in the sodium potassium ATPase pump. So and on the inner side you can see there is a ATPase binding site. Okay, there is a ATPase binding site, it to which ATP will bind. It will be degraded into ADP and high energy phosphate. This high energy phosphate is used to pump the sodium and potassium. So here what will happen, first the enzyme ATPase will get activated. ATPase will get activated when 3 sodium ion, this is the cytoplasm and this is the outer side. Okay, so whenever action potential is generated, there is an influx of sodium, right? Now this sodium, it is according to the gradient, right? So now it has to pump back. So on the inner side, 3 sodium ion, 3 sodium ions and 1 ATP molecule will bind to their respective sites. Once it will bind, the activated ATPase enzyme will cause hydrolysis of ATP and it will cause formation of ADP and high energy phosphate, right? So it will liberate the energy, right? It will liberate the energy, that is a phosphorylation. So it will once the energy is liberated, it will cause conformational change. This will cause conformational change in this carrier protein. Okay, it will cause conformational change in this carrier protein and it will cause movement of the 3 sodium ions outside. Okay, it will cause movement of the 3 sodium ions outside. Now once the 3 sodium ions are moved outside, on the outer side there are binding site for potassium. So 2 potassium ions will bind on the receptor side in the extracellular fluid compartment, okay, to the carrier protein, and it will cause dephosphorylation of alpha subunit, right? This is alpha subunit. So it will cause dephosphorylation of alpha subunit. When and it this way it will cause the it will cause the movement of the two potassium ions inside. Okay, so initially 3 sodium ion and ATP will bind on the inner side. Then ATP will degrade, it will cause generation, or it will generate the high energy phosphate bond. It will cause phosphorylation of the receptor protein, and it will pump the 3 sodium ion outside. Right now, on the outer side, 2 potassium ions will bind and it will cause dephosphorylation. Dephosphorylation of carrier protein, and it will pump 2 potassium ions inside. So this is how the sodium potassium ATPase pump will work. Okay, now see this here. 3 sodium ions are exchanged for 2 potassium ion, means more sodium ion is pumped outside as compared to the potassium received inside, right? It means it is creating the negativity. It is creating negativity inside. Okay, inside the cell it becomes negative. So it is important electrogenic pump. Okay, sodium potassium ATPase pump acts as an electrogenic pump. Now come to the next one, that is phagocytosis. Now what is this phagocytosis? See this mechanism. Phago means eating. Okay, eating up by the cells. So here what will happen, solid particles, when it come in contact, the one which needs to be digested, okay, that solid particle, when it comes in contact with the cell membrane, any foreign particle, any substance which needs to be digested, when it come near the cell membrane, it will cause invagination. Cell membrane will first invaginate around the substance. Okay, gradually the cell membrane come close to each other, and finally it will fuse. When it will fuse, it will take the substance which needs to be digested inside the cell, means in the cytoplasm. In the cytoplasm there is lysozymes, right, which contains the different enzymes. Okay, different phagocytic enzymes are there. Okay, so this will fuse with the substance which needs to be digested. Okay, and it will empty its content inside it, so it forms the phagosome. You can say here it is called as a phagolysosome. So once the content is endocytosis, now come to the next one, that is pinocytosis. Pinocytosis means cell drinking. Phagocytosis is cell eating. Pinocytosis means cell drinking. So here what will happen, liquid particle, the process is same. Like phagocytosis, but here the liquid particles will be digested. Okay, so whenever the liquid particle which needs to be digested will come near the cell membrane, it will move. Cell membrane will enfold around the substance, it will be taken up inside, and it will fuse with the lysosome, and it will form phagolysosome. Same way it will be digested. Now come to the next one, that is a receptor mediated endocytosis. See, receptor, understand the word carefully, this is the important question. Receptor. Hello Ishu, I am good, I hope you are also doing well. Receptor mediated endocytosis. See the word carefully, receptor mediated. It means for the process of endocytosis, we need, endocytosis means taking up inside, exo means throwing outside, right? So for the process of taking up substance inside, we need the receptor, right? So see, this is the substance which needs to be taken up inside, and these are the receptors which are present on the outer side of the cell membrane. On the other side, these are the receptors, these are the substances which needs to be transported. Here there is a very important role of Clithrin molecule. Okay, Clithrin, this is important, or you can say Clithrin mediated endocytosis. Okay, so Clithrin plays very important role here. Now what Clithrin does? Clithrin is a triskelion shape with three legs which are radiating from the central hub. Okay, three legs are radiating from the central hub. During the process of endocytosis, the Clithrin molecule will form a geometrical array. It will form geometrical array and surround the endocytic vesicle like this. Okay, so here what will happen?